Hi, this is Dr. Inky Parrack returning to Whiteboard Wednesday talking about varicose vein part 2. So today we're going to talk a little bit more about differences in varicose veins that are deeper or bigger varicosities and smaller, which are reticular varicosities and spider veins, and some of the similarities and differences in terms of the treatment specifically. So we talked about what varicose veins are and where they can be located. So let's specifically kind of concentrate a little bit on the lower extremities and talk about the big varicose veins that you see that's bulging out of someone's leg that you can easily see versus the little bit more cosmetic ones that you see, all of these little purple cascades that you see on patients' legs. So those are two different types of spectrum of venous dysfunction, one of them being big varicose veins and the other one reticular varicosities or spider veins. So when we're treating this, there are two big modalities that we attack, and they're similar in technology, but extremely different in how they're actually employed. So one of the techniques is considered ablation through sclerotherapy. So sclerotherapy basically means you inject some sort of a caustic chemical to shut down whatever it is, to burn it shut. In doing so, in terms of the chemical for the varicose veins that are huge, these are usually talking about the veins that incite the varicose veins to come out. Inciting veins meaning usually the greater saphenous vein, the accessory saphenous vein, or the small saphenous veins. You don't always need all of these treated. And in fact, you don't always want to treat it for every purpose, because these greater saphenous veins that we're talking about, which are the veins that actually you might be able to see on the medial portion of your ankle, and these are little purple veins that sit kind of near your ankle bone and come up. That vein is the same vein when doctors tell you you need a triple or quadruple bypass. That's the vein that we take to put into people's heart, people's arms, people's legs, many different parts. So it is actually a great spare part that we carry around. We don't have to have it, but I would like to have it for my family history, and I hope that we would be able to keep it for you if it is at all functional in some way. But in some people, it is non-functional for one, and for two, it has become so dilated, so stretched out that it is no longer a good spare part, meaning it's like carrying around a flat tire in your trunk, which is useless. It just weighs things down, doesn't do anyone any good. So in those cases, we can shut it down, and the one method that we were talking about is via some sort of ablation via chemical, which means that we inject a foam that is caustic into that greater saphenous vein, and then it causes that vein to spasm shut. It's a very similar technology that we employ in terms of sclerotherapy to the spider veins. It's very similar chemical, which is caustic to the veins, gets injected into that component of the vein that we want to get rid of, and it actually makes it also spasm and basically burn it shut. Once that's successful, these are gone, these are out of your body, don't have to worry about it. The other possible option for the varicosity component in terms of the greater saphenous vein or even the spider vein external component is we can use some sort of a energy-based. So whether it be laser or radio frequency, there's a laser and radio frequency that could be used in an endovenous manner, meaning we put this into the blood vessel, namely the greater saphenous vein, and it's usually a catheter that carries this energy inside, and then it burns it shut from inside out. If we're talking about these tiny superficial veins like the, spider veins, then we actually have external beam of laser, and we actually put that on, and from outside we can employ the laser energy, and we can also shut it down. A lot of times these two techniques of doing either a chemical therapy or energy-based therapy works in conjunction. So it's not one versus another. Some people it's clear cut, you just use one and that's it. But a lot of times you do want to employ the two together to get the best outcomes. So even the two technologies may look very different and may seem very different when you're getting it done to you. The two have very similar bases in terms of what needs to be done to get rid of the blood vessels, because at the end of the day, they're all blood vessels. So this is the kind of the nitty-gritty and a little bit more specific into treatment of varicose veins, spider veins, reticular varicosities, the spectrum of disease that we all hate and we get plagued with. This is Dr. Inky Parrack, Whiteboard Wednesday's Varicose Vein Part 2.
you.